Now, other reasons that people should be evaluated for. So if something doesn't make sense where we think people are progressing in the normal fashion with regards to their CLL, the doctors need to do a little digging. We need to fish. We need to look around. So if somebody has isolated anemia, I'm gonna work that up. Because really, when people start progressing with their CLL, we also wanna see other changes too. So if your white count's exactly the same, but your hemoglobin's dropping, your platelets are the same and your lymph nodes haven't changed, there might be something else going on. And so it's really important to look for other causes of, let's say, the cytopenia, whether it be anemia or thrombocytopenia. If there's an isolated cytopenia or an isolated change, we want to make sure there may be something else that could be contributing to that, because we might treat that differently. So for people with autoimmune hemolytic anemia or autoimmune thrombocytopenia, for those of you out there, you know what this means. There are blood tests that we can identify if you're hemolyzing, that's the catchphrase, right? You might have heard that if you're actually, your marrow's actually making your red cells fine, but they're chewing them up in the circulation, it's related to your CLL, but we may give you different therapies. So it's important for the doctors to make sense of what's going on with your blood counts to make sure it is your CLL, because what we might do might be very different if it wasn't your CLL, or if it's an autoimmune process versus maybe you're having some gastritis. That's a great consult. Anemia, I scope them, they got gastritis or H. pylori, I fix it, they don't need chemo. Nice, huh? So you have to look at other reasons that may not make sense with your CLL. Now, very, very aggressive disease. So for people, I know that we focused a lot about Richter's transformation yesterday. That happens in about 10 or 15% of folks. And we see it more commonly in patients that have had multiple prior chemotherapies for their disease, really because their disease is just becoming resistant to treatment. Okay? So yes, it can transform. The most common is to a large cell lymphoma, but as Dr. Keating said yesterday, there are some rare transformations. We don't think any of them are good. Okay. Now there's some people who transform, and I spoke to a few of you, I think yesterday, who might have had transformation, but never had chemo for your CLL. You guys are still curative of your transformation. Your CLL will always come back, okay, until we're smart enough to get drugs that don't make it come back. But your CLL might come back eventually, but your large cell lymphoma could be cured. So there's two different very big groups. Most are in the other caveat, very heavily pretreated, but there's a small subset, never treated, can be cured from your large cell lymphoma or your Richter's transformation.